Hello. I'd like to take a moment to introduce my research proposal to you. This idea came from my time spent at a level 1 acute care trauma hospital. In working at the hospital, I found that there was a big gap in the ability to figure out exactly what was happening with our young traumatic brain injury patients. So this proposal hopes to create a brief cognitive screening tool for young adults with traumatic brain injury in the acute care setting. The focus of this study is to identify the essential functional features and psychometric properties required for a brief, occupation-centered cognitive screening tool that enables occupational therapists to effectively evaluate cognitive function in young adults with traumatic brain injury in the acute care and acute rehabilitation settings. So basically what I hope to do is create a tool with practical features. So a tool that is brief, has an ease of administration, has functional relevance, minimal materials are required, and there's adaptability. For psychometric properties, it's measuring what qualities must the tool possess to be considered scientifically robust. It needs to be valid, reliable, sensitive, and specific. Clinically, I hope that occupational therapists will use this in the acute care and acute rehab settings where they can have a quick yet accurate cognitive assessment that can be used for discharge planning, safety evaluation, and intervention prioritization. So what is my research question? My question is, what features and psychometric properties are necessary for a valid and reliable quick cognitive screening tool that occupational therapists can use with young adults with traumatic brain injury in acute settings? So this research matters because it addresses the lack of brief, clinically relevant cognitive assessments for young adults with traumatic brain injury. Developing a valid, reliable, and occupation-centered tool will enable occupational therapists to efficiently identify cognitive deficits, guide interventions, and improve functional outcomes for our patients in the acute setting. Currently, cognitive assessments such as the MoCA or the Mini-Mental are primarily designed for adults or older adult patients with dementia, making them less sensitive or even relevant for our younger TBI patients. However, often these patients have functionally significant cognitive deficits in attention, memory, executive functioning, and more that are not captured by the current tools. These patients are at risk for missing diagnosis and having a delay in interventions. Acute care and acute rehab settings are fast-paced, and occupational therapists greatly need a quick, reliable screening tool to guide intervention, the safety assessments, help with discharge planning, and help to prioritize treatment interventions. Your role will be to create a literature review based off of the information I previously provided, and then hopefully we can create an IRB proposal that can be used to do research. That ultimately our goal is to present this in a poster format or as a presentation at one of our occupational therapy conferences. I hope you find this interesting, and I hope that we can work together. Thanks so much.